Let's now look at communication around HIV/AIDS and how effective this is, and speak to Yashmita Naidoo, CEO of HIVSA. Thank you so much for your time this evening. Fatigue seems to be setting in, particularly when it comes to, some people who are seeing either campaigns or anything like that. It appears that, sometimes people don't pay as much attention as they should. Is it an issue of the communication strategies around HIV, or is there something else at play here? Do we need a different approach, perhaps?
Thank you so much for the question, and thank you for having me on the show. I think this year's World AIDS Day theme of Let Communities Lead is very apt, because I believe that the clinical interventions are in place and we're ready to go as a country. And we've made gains in terms of achieving our UNAIDS 95-95-95 goals. But clearly, our performance at this stage tells us that much more work is needed with regards to getting more people to know the HIV status and to get those that are HIV positive onto antiretroviral treatment. And if you look at our prevalence in the country at the moment, as per the latest HSRC report that was released this week, you'd find that our highest prevalence sits in the age group of women between the ages of 15 and 29 years. And what that tells us is that our communication needs to be more targeted and more appropriate to that age group. And we need to use innovative ways of communicating with this cohort of people and identifying media that is appropriate and relevant to them. And the content on the communication, or the content that we use, also needs to be more interactive, where we get the targeted audience to interact and to say what their challenges are. So, engaging communities and having a deeper understanding of what more needs to be done to overcome the existing barriers to achieving those 95-95 targets is absolutely critical at this point in time.
So does it then, because as I'm listening to you, you're saying listen more, in fact, and go on a fact-finding mission than you just tell people how to, process some of the information. Does it help then to, reach some of them in their platforms where they would be communicating, for example, social media?
Yes, I think social media is an absolutely powerful tool. We've got a myriad of youth influencers, that have an impact on youth specifically and are able to get the message across. And we need to harness and leverage of those gains and to get those influencers involved in HIV messaging, because it's absolutely critical. The truth is that the lecture style way of communicating messaging on HIV is not working, and we've seen that. And we need to be more creative around how we engage young people and get them to actually understand the implications of risky sexual behavior. Because often in our experience, communication or questions around HIV don't come out directly. They're often masked behind questions around love and relationships or sex and pregnancy, and HIV seems to be secondary as a follow-on question. So we need to understand what are the needs of young people, at the forefront. What are their primary needs, and how do we then tackle the issue and address issues around HIV and provide that much needed education.
So what role then do healthcare workers play in this particular conversation, because they are also disseminating information?
Yeah, I think you're raising a very important question. And for a long time, the adolescents and youth in our country have said that, we unfortunately very far from having youth and adolescent-friendly healthcare services, particularly sexual and reproductive health services. And I think there has been some improvement, but there's much work to be done. A lot of young people still feel that the services are not appropriate for them, or that they're not suitable to, their lifestyles in terms of having to attend school and then missing school to attend, to get sexual and reproductive health services. They still experience a lot of stigma and discrimination from healthcare providers, unfortunately. And I think, more training is required, more sensitization is required of the healthcare professionals. And perhaps we also need to look at, the age groups of our healthcare providers. We should be getting younger people to provide these services so they can relate better to young people, because at the moment, some attitudes of healthcare providers is a deterrent to young people accessing the sexual and reproductive health care that they actually need in the country.
And I suppose, as you say, then, if these young people are there and they are providing this particular, kind of advice to their counterparts, do they then do it in a specialized setting, or must they also form part of, the healthcare system that continues to exist? So possibly we don't maybe, stigmatize them somewhat.
Yeah, I think, providing sexual and reproductive health care services falls within a continuum of care. So it's not a once-off intervention. And what will be critical is to be able to establish relationship with young people, to know that they can come back and return for a service. And as in the case of HIV, it's not just getting the test. It's about, okay, if you test negative, how do you remain negative? That conversation needs to happen. If you test positive, what are the implications? What does that mean? What are the benefits of treatment? So it's a long-term relationship. And I think that a lot of healthcare providers are getting it right, but there's still much work to be done. However, I think the community has a strong role to play. We have many community-based organizations that are doing excellent work in the space of HIV, and they have youth coming to them on a daily basis. So those are opportune moments where we can engage youth and educate them and have real conversations about what the challenges are, and potentially look at decentralizing sexual and reproductive healthcare services from the facility and moving them towards community where, potentially with a mobile healthcare service where there's no stigma or fear of judgment from the community as well as the healthcare providers themselves.
Yashmita, you mentioned something so critical, as we end off our discussion there, that if you test negative, conversations should be happening with you as to how do you stay negative. But let me thank you so much for that. And this has been really a fruitful discussion as we look at, some of the effective tools of communication. Do appreciate your time. That is Yashmita Naidoo, CEO of HIV South Africa. When we come back, we're taking a look at some of the targeted methods or prevention methods, that is, or strategies that are needed in order to ensure that we also tackle, some of the vulnerable groups who are finding themselves with lots of questions.